Welcome to the village. Today I have labor and delivery nurses, Erin and Brittany. Hi guys.
Hi.
Thanks for being here.
Thanks for having us.
So this episode is geared more towards to-be moms, pregnant moms, or brand new moms, or moms of new babies. So being labor and delivery nurses, you guys are kind of the experts. Why don't we start by just giving moms a heads up about what to expect? What is the journey going to be like? Why don't we start with the importance of prenatal care?
The importance of prenatal care. Lots of reasons why you want to get prenatal care. The earlier you establish with a provider, the earlier your chances to build a connection with that provider and that practice. And also, making sure that you're getting yourself checked out and that your pregnancy is going healthy. All your questions are being answered, that you're taking care of yourself, you're making all the necessary changes that you need to make in terms of your own health so that you can carry a healthy pregnancy. Preparing for labor and delivery. You kind of can start that right in the beginning, right when you find out that you're pregnant.
Yeah, and it's really important with the prenatal care too. I think that just going, you're going to learn bit by bit with every appointment what options are available. And I think in order to feel like you are in control and doing everything that you ultimately want to end up doing, you need to know what all of your options are. And in order to do that, you kind of need to go see people who know what those options are. So getting started straight from the beginning not only lets us know your baseline and making sure everything's healthy with both you and the baby, but also helps, again, giving you those options, giving you time to think about what you want to happen by the time you get to labor and delivery.
Yeah.
Well, that's a good point. I mean, there's things that expectant moms may not even know that they're supposed to change or do or and prepare for. There's different options. Like, what kind of options would you say? Like, options for who's going to deliver their baby, options for the hospital, options for how to have their baby delivered.
Everything under the sun. So as big as who's going to deliver you, how you're planning to deliver, pain medication options or just therapeutic options like massage, hydrotherapy, epidural. There's lots of different things that, again, there's so many options that some people don't even know that they're a choice. And some hospitals, some birthing centers, home delivery, all of them come with different options. So picking a provider based on what you're already thinking you might want and then talking to them about what options they have available will help you to start to navigate that process of what you even want for your labor process. And then even postpartum, how much they help you postpartum. Do they have any support groups for just postpartum moms or breastfeeding or support at home? Do they have home services? All of that comes with not only going to the office, but calling different offices, visiting their website, and all of that stuff can happen even before you're pregnant, let alone early pregnancy.
So when you say that, I think there's so much information. I'm getting overwhelmed thinking about it. So I could imagine what our expectant moms go through. There's probably information they don't even know that they should be looking into. Mm-hmm. So it's great to have, like you said, a provider who's actually going to help them in this whole process. So they have that entire 9 months to really start thinking about these things. Now, what type of providers are there? Now there's this broad term of providers, right? So I always used to think midwives, that was an interesting concept. When I went to medical school, I actually had my OB rotation where there was some midwives as well as OBs, and they seemed to have some different techniques. They would teach the students about delivery and relaxing, birthing area. So do you think there's a difference? Is there a suggestion for different moms, different personality types, who they'd be comfortable with? Does one have a benefit? I mean, the obstetrician, gynecologist, that's a doctor. The midwife has all these techniques. So who should they be going to?
I think a couple things. So I think, first of all, expectant moms should kind of envision the type of birth that they think they want. And a big part of that, at least these days and in most areas in the United States, is it's less about, I think part of it's the provider, but also part of it is the environment that you're going to have your baby. And most people are going to choose a hospital birth. And so choosing a hospital that sort of is going to be able to provide you the birth that you want to have, and then finding providers that deliver at that hospital.
Okay, so
there's
first the hospital.
So my
second.
recommendation is always find the hospital that you want to deliver at. And there's a lot of resources out there where you can look at hospital statistics. Like New York State has a website on maternal child health stats where you can look at their C-section rate and their breastfeeding rates and all that stuff, and kind of finding the hospital that's going to align with your preferences and your values. And then from there, finding a provider. And there's great OBs and there's great midwives. And I think both can provide really great care and provide experiences on a wide range of spectrum. There's more medical midwives, there's more non-medical midwives, there's more medical OBs, and vice versa. And an obstetrician is a doctor, an MD or a DO, and they're a trained doctor who goes to medical school, and they're also trained in surgery. So in the event of a C-section, that would be an OB providing that. A midwife is, in the state of New York, usually a trained nurse who then goes on to get a master's degree and is trained specifically in vaginal deliveries. And they do lots of vaginal deliveries, but they're not trained in surgery. So they wouldn't be doing a C-section.
And the one benefit about if you do go the midwife route, and especially more so in the case of birthing centers and home deliveries, is that the midwife is trained to help with that postpartum, that initial postpartum care, and even care of your newborn. They can do a lot of that. Although you're still going to want to think of a pediatrician for down the road. You're going to need that set up eventually as well. And then again, the benefit of a obstetrician or a doctor is that most of the time women are getting some type of gynecological care prior to pregnancy. And that's usually who you're seeing. Now, all the time, midwives are in offices all over and they also are doing gynecological care. But almost always somebody already has some type of repertoire with an OB. And again, they have that surgical service. However, a lot of midwives also are working with OBs. So if you are originally planning a vaginal delivery and that for some reason changes and you end up needing a C-section, most of the time your midwife already knows some OB doctors or is working directly with an OB doctor to help you. It's not like you're locked into one choice or another. They both have their pros and cons. I guess you could say cons. I think they all just have different types of pros. And it's just finding somebody that you jive with. It's almost like dating. You just gotta find someone that you like.
And like you said, like dating, you can go online and try to look some things up and see what people are saying. Are there any specific websites moms can use for some more of this information? I think looking up at doctors on healthrates.org has always been a good way for me to find some of my own doctors. That's actually how I found my own gynecologist.
Yeah.
She's worked out great. Is there some other websites like just for expectant moms or anything that you guys recommend?
I would look up local hospitals and then doctors' profiles directly on the hospital profile.
Yeah, what's great about nowadays is you can literally just pull up Google on your phone and type in OBGYN near me, midwife near me, places to have babies near me, anything like that. Hospitals nearby with a maternity center is going to pop up, and you can go again directly to the website. A lot of places have Facebook pages now, Instagram pages. There's lots of mommy groups online that if you find one that's kind of local to you, a lot of people end up putting up their stuff on there. People will tag hospitals with their experience.
Everyone's got an opinion. They're not afraid to share it.
Yeah. And then, asking, word of mouth and like people that you trust have and their experiences, that means a lot as well. So not discounting that.
And almost always there's going to be, almost all hospitals have some type of, prenatal education course and tours available of their unit where you get an opportunity to ask some of those questions that you might be wanting to know. Again, like what type of stuff that they offer. Do they offer? Is anesthesia there all the time? Do you have a birth tub? Like all those types of things are great during tours. Again, a lot of these places will have it on their website as well.
Yeah.
If I'm not mistaken, U.S. Newsweek, actually annually, they come out with a rank list of best hospitals for different specialties.
Mhm.
And moms could look up like maternity, labor and delivery. So it's good to see a good birthing center. And like you said, take a tour.
Mhm.
And the other thing, like you mentioned with the pediatricians, I know in my office, we definitely have expectant moms interviewing pediatricians all around the area
Mhm.
to see the facility, the office, take tours, and book appointments with the pediatrician to actually do an interview.
Yeah.
I've been interviewed several times prior to parents choosing me because that's your baby's doctor. Just as important, if not more important to some moms, their baby's health. So
Yeah, and that's also like important to start thinking about while you're pregnant before the baby's born is, you know, in those last couple months of pregnancy, picking a pediatrician.
Yeah.
And your pediatrician may or may not come to visit your baby in the hospital, but establishing care or speaking with them or kind of getting a feel for their practice values and the way that they practice and sort of where they fall on that spectrum of really medical or more natural, homeopathic, all of that stuff. So that's good to kind of figure out start to think about while you're pregnant and then.
And just knowing a lot of people don't know that not all practices are accepting new patients all the time. So if you're able to think about this, you know, while you're pregnant, again, not, okay, the baby's here, who are you going to pick? And you're like, well, I heard this person's good. And then unfortunately you found out, oh, they're not accepting new patients. Yeah. So now you don't know where to go. If you're thinking about this a couple months before the baby comes, at least you get a chance to call their office and be like, hey, are you taking new patients? Yeah. Is there something I have to do to get into your office? And again, also gives you that opportunity to ask some questions if you're curious about how they normally care for babies, what the schedule's like, what they recommend. And again, kind of pick somebody just like your OB or your midwife, somebody that you feel like you're going to connect with.
Yeah. Especially because those first couple months with a brand new baby, there's a lot of doctor's visits. And to not really have a pediatrician lined up can feel stressful because those, especially the first couple of weeks, there can potentially be a lot of visits to a doctor and a lot of questions and so many, it's a time where you really kind of want to rely on someone that you trust to give you that medical advice and reassurance that, you know, your baby's growing and eating well and gaining weight and all the questions that you have. So to have a relationship established with someone, or at least know and feel confident in your choice in the practice, is really good to have before you even go into that period.
Yeah, I agree. Especially, you know, you want to know, like you said, how they practice with all these different opinions floating around. Moms or new moms or parents are getting confused. They're hearing a lot of voices about vaccines and medication and autism, and they're just confused. There are so many people scared now, very scared of a lot of things. So it's good to have somebody you trust. And I think people's voices, like on websites and on mom groups and even their moms, like grandmas, aunts, other friends, there's a lot of voices. So if you can trust the voice of your pediatrician, that's going to help you through a lot of these doubts. I think that's something I found, that why are we having a hard time with not being compliant with vaccines or even with the exam in a maternity ward? Why are we not having compliance with moms and babies and patients? Because the lack of trust. So I think if you can trust somebody who's providing medical care first for you as a pregnant woman and then for your baby, that's going to make a huge difference in how you feel about the care you get. Mm-hmm. And well, having said that, now being there in your actual, so you've made your decision, now it's the day. Well, how do you know it's the day? Like, what should moms do? Now, this is, of course, moms who've already had a baby probably already know what they're supposed to do and what it feels like when you know you're actually in labor. So are there things that they should look out for if they're first-time moms? Like, how do you know that it's now time? What should they do?
I would recommend a childbirth education class to any first-time pregnant mom. I think it's totally invaluable. I think that having cared for moms who have taken childbirth education and not, the moms that do invest in that seem to cope and fare so much better in terms of how they enjoy and how they experience labor and delivery. So starting off, if you can, even if you can't take a formal in-person class, there's so many online resources, really doing a lot of education, finding an online class. There's lots of resources too, like there's a lot of free education. So doing your best to really educate yourself about that.
A lot of hospitals offer some type of course, and a lot of them are free. Some of them are small, minimal charges. Some, even if they charge, if you're in a financial circumstance that you can't afford it, they will basically grant you and not force you to pay. You know, they want patients to be educated and feel empowered, knowing that they know all of the information and that they can make nice informed decisions because they've had time to get all of the information. And then knowing, so some things, so say you did all that, but you're still not 100% sure, and you're 39 weeks right now, and you're not really 100%. Am I in labor? Am I not? Obviously, you can call your hospital and talk to a nurse, and they will tell you, or your doctor or your midwife. There's always usually some patient line that you can call and ask questions day or night. But some things that are just general information is, say you're 39 weeks and having contractions, but you're not sure if it's quite time to go in. The general rule of thumb is usually you're having contractions that are about 3 to 5 minutes apart, which you time from the beginning of one contraction to the beginning of the next. The contractions are lasting around 60 seconds, so about a minute. And that's going on for about an hour, and they're not really changing. They're staying pretty regular. Usually that's time to at least call and check in with whoever your provider is or the nurse on the maternity unit and ask, hey, this is what's going on. I'm not sure. Should I come in? And they'll recommend one way or another.
So Macy has joined us. She's also a labor and delivery nurse and mother of 2. So I always think it's a little interesting being a pregnant woman and seeing pregnant women giving birth.
Mm-hmm.
Describe that to me.
Well, it's kind of hard to think about. I mean, you have your own experience and how you feel, and they might not feel the same. They might have it easier. They may have it worse. They might prefer certain things. So you try to just support them in a way that, you know, they would want to be supported and just make them feel comfortable, and maybe you can connect to them on certain levels with like how if you have other children or previous birth experience, and just try to connect to them with the way that you're feeling. And
So you feel out the patient. So every patient, every mother is different. And what kind of support system is there in the hospital when moms are giving birth? And what kind of support can they expect to have? Or does that depend on the hospital, or does that depend on what they need? And who can they expect to be in that room with them?
well, obviously, if they have a support person, like their significant other, or family member, close friend, that could be someone, but definitely the nurse is a huge part of it, or, you know, the provider, whether it be a doctor or a midwife, and just helping them cope. We ask them, you know, how they want pain management to begin with at first, so we can see if they want to do aromatherapy or music or rocking or shower or coaching, breathing. There's a bunch of different options that you can use, and you just have to find out what makes them feel most comfortable and go with that.
And some people decide to hire a doula. Doulas are a
I was
thing,
gonna
and
bring
they're
that
starting
up.
to get more
Yeah.
popular again. I
What
feel
is
like
a doula, really?
well, a doula can really be anyone. Preferably, you will get somebody who is certified, educated, and a lot of times, doula can be your own personal birth educator. So you can hire a doula straight from the beginning of your pregnancy, and that can be the person who's giving you your childbirth education, support you through your prenatal stuff, again, so that way you know what options you have, help you navigate that process, help you with finding a pediatrician, and
So
then
your
can also
personal,
be
like-
here. Yeah,
Sure.
like your own personal
Like a wedding
assistant.
planner,
Yeah,
birthing
basically.
planner.
Yes.
Are they
And,
expensive?
it depends on where you are and what you're doing. Some people will just ask a friend or a family member to like basically be that person. But again, if you're gonna hire somebody who's actually certified and educated, then you know, it just depends. It kind of course can come at a price. You just kind of gotta look online, and just like any other provider, call and ask and see what the rates are and compare and what they offer, because every doula is going to offer more or less support. Yeah, so every doula is just like providers are going to be different in order have more or less support, and then you can just have somebody who you're planning to just be at labor and delivery, again, because sometimes bigger hospitals, bigger hospitals, the nurses can't be in there as much as, say, a smaller hospital.
That's a good point.
So
Good to know.
sometimes having that consistent, you have somebody in there all the time, suggesting different positions, helping with like massage or again, aromatherapy, music, whatever it is that you're needing, sometimes can be nice, but sometimes people don't want that extra person. They are a little more solitary, so you kind of got to go based on your personality.
That's a
and what
good
you
point
like.
you brought up. That's really important to note if you're in a smaller community hospital and you want that one-on-one with your nurse a lot of the time versus if you actually don't want so much support from the medical staff and you have somebody personal to bring with you. Now, when you were mentioning with the music and aromatherapy, I think that goes along with what we were saying with the kinds of pain options. So I think a lot of moms think about this and they've pre-decided from the time they're a teenager, I don't want any pain medicine. My mom did it naturally. So how do you make that decision? And if they don't choose pain medication, what's the option? If they do choose it, how does that work?
So it's always a fluid experience. It's not like if you tell us, I don't want an epidural, then it doesn't mean that you can't get one if you change your mind. You can play music on your phone or use, essential oils or even the hydrotherapy tub. There's different options that you can use, IV medication that we can give you or the epidural. Once you're able to get it, that can help you as well. So there's a bunch of different options. You would just have to ask and find out more information and really just weigh those options for what's going to suit your birth experience.
And I do think that you should do some research and, again, see how you feel. And if you want to come in saying, absolutely, no epidural, that's not what I want, that is totally fine. And, again, hopefully you're going to have a nurse that will help support you through that. Or if you do decide to go the route of a doula, they'll definitely help support you through that. But then go in knowing that you don't know what you don't know, and that sometimes things change, and it's good to be open and hear all of the options. That way, if things change, you know what the next options are. But know that you can ask questions, and that when people are telling you things, that there is an opportunity to ask more for elaboration, to say yes or no to things. And that, again, you're never locked into anything, and that when you are given information, it's given information to you to make a choice. It's not to tell you what to do. So you have that power, again, to ask questions, to say yes or no, or to, maybe I need a few minutes to think about that. That is all your right as a person, as a patient, as somebody who is paying for a service.
Right.
Those are all your rights, and it's your birth. And so you can have it however you want, but know that, again, things can change, and that you may want to change your mind, and that doesn't make you a failure necessarily. It just means that you didn't know that certain things were going to happen. And until you know that that thing happens, you might not know how you're going to react to it.
Yeah, so stay open-minded, but also ask questions. And it's okay to be given a few minutes to think about it.
Yeah,
you don't have to always make a decision that second.
Yes.
And that's something important for people to remember.
And with that being said, if you know that you're somebody who wants an epidural, ask when that facility normally offers epidurals, because every facility is going to have a different policy. Or if you know you want a natural birth, I might recommend that you might want to stay home as long as possible. As long as you're feeling well, you're still feeling the baby move, you're feeling good. You might want to stay in your own environment where it's a little more relaxed instead of coming in early labor and being, on monitors and in the bed. Again, it's just knowing what you want and talking with your provider about, well, if I know that this is something that I want, how can I get to that point? And hearing their opinion. And again, maybe even looking up some stuff online, some videos, some inspiration. Some people love different classes. Like Lamaze is a little more old school, but there's stuff like hypnotherapy now and all sorts of things that can kind of help you guide you through that labor process and learning to cope through those contractions.
Yeah, I would recommend that if you do think that you want to have an unmedicated delivery in terms of not having any pain medication or an epidural, like it is really invaluable to do a formal preparation class, whether that's like maybe not a formal class in that you're paying for it, but doing some some actual preparation and not just winging it, because you have to have the coping mechanisms to really have a successful birth in that way. And so coming prepared with those, and you may not use the exact coping mechanisms that you're expecting to use. Everyone kind of handles that pain. I don't think you know exactly how you're going to handle it or what you're going to want in the moment until you're going through it. But having lots of tools in your tool chest so that when you do show up in labor and that you're actively laboring, you have lots of options to pull from and to.
So mentally prepare.
Yeah. So mentally prepare, have a good support team around you, making sure your partner is the person that's going to be there, your main support person, whether it's your partner or your mom or whatever, is really knows what you want and knows how you've been thinking about birth and what you've been expecting, and that they are also coming armed with some tools to help support you through what you want your birth to be.
One other person who's really going to be there and available at that time.
And so that way they know that essentially that you're both going to be on the same page. Again, knowing what your plans are, knowing what you're open to, knowing, like, say you learn a certain technique of breathing, them knowing that technique of breathing to remind you of that through labor is good. Or if you're somebody who wants like mantras told to you, or if you want massage, again, kind of knowing that and learning that, and the person who's going to support you knowing that ahead of time will be very helpful. So that way when you're in that moment, you're not trying to explain that to them while you're uncomfortable and having a hard time catching your breath.
Then you can get, your mind's probably not in the mood to listen. You have to really prepare as much as you can for something that you really don't know how it's going to feel. Mm-hmm. It's like they say, there's really nothing that feels the same. It's hard to really describe that.
Yeah, an easy thing to do is like just watching birth videos on YouTube. It's so easy. It's free, and you can find like a range of birth videos in terms of like, you can see women birthing with an epidural. You can see women naturally birthing without any pain medication, kind of hearing what the sounds are like and seeing what a woman looks like in labor, so that just witnessing birth. We don't, in this culture, routinely see women, unless you're a labor and delivery nurse, you don't routinely see women give birth. Yeah. So if you're a first time mom giving birth, that experience can feel really scary because you're just not used to seeing it. Yeah. Whereas historically, I think in ancient cultures, women were together supporting one another through birth.
Potentially other countries today, too.
Exactly. So, so just watching birth is a good starting
being more part of how natural it is.
Yeah.
And two of you, like I said, Macy and then Erin too, have your own children. Is there anything you can share from the mom perspective, somebody who's given birth and knows, a lot more about it than other moms in terms of the medical? So how can you use that to share with the people who are listening to this about your experiences with giving birth, being a mom, breastfeeding, taking care of kids? Any words of wisdom or just words of experience?
It's hard. Yeah. It's definitely difficult. So
the birthing part or the mothering part?
Well,
all of it.
I, had 2 children, and my first experience, it was a pretty short labor, only like 7.5 hours. And I had an epidural, and my husband was here, and it was pre-COVID where I could have visitors and, everyone was there, versus my second. It was during COVID. My husband did not make it because I delivered so quickly. So you kind of just have to adapt. As Erin was saying before, it's the circumstances may change, and you just have to kind of see what the options are and kind of go with it as you go. So as a nurse, you kind of pick up on certain things. Like I had a hemorrhage for my second, and it's scary. And as a nurse, I know what that means. So maybe if I wasn't a nurse, I wouldn't have been so worried, or I might have. So it's just, you kind of have to be educated in either way. So it was like, almost I had to remove myself from the nurse in me and just trust that the professionals around me are doing what they're supposed to be doing, and just focusing on me and healing and my baby.
That's great advice. Trust the professionals and focus on your own healing and health at that moment.
Yeah.
That's really the best thing.
Being educated is not a bad thing. That way you can advocate for yourself and kind of be able to make your own decisions, as Brittany was saying, because you do have a choice. But at the same time, sometimes knowing less is more. It makes more anxiety if you know what's actually happening at times.
Right. It's a danger of knowing too much.
Right. So, yeah, I mean, and just accept the support as long as you're willing, because it does take a village at times to be able to get everything done and feel yourself. So it just accept the support.
Yeah,
And
accept the support and don't go it alone.
right.
And speaking with the COVID situation, and hopefully that's going to be a thing of the past at some time. I don't know when or how, but it's getting better. Now, how has that changed the situation for mothers who are giving birth now in terms of, like you said, there couldn't be too many other people around? How has that changed on the COVID floors? And what about moms who are suspected to have COVID and their swabs and their times with their babies? Has anything changed with that?
In terms of labor and delivery, relatively speaking, I don't think it's changed as much as one might think. The biggest change is that we're really limiting the number of people allowed in the hospital just to limit exposure in general. So moms are limited to have, at least in this hospital, every hospital is a little bit different, but in the hospital we work in, moms are allowed to have one support person present during their labor and delivery stay. So that usually looks like a partner. But then even after the baby's born, limiting visitors, so not allowing grandparents and siblings and friends to come and see the baby in the hospital.
So are moms getting discharged quicker, or is that still not really changed much? So
I would
they can go home
say
to-
yes and no.
Yeah.
I think moms are a little more anxious to get out, especially if they have other children at home, because they miss them and they want them to meet the new baby and stuff.
Yeah.
But if it's a first time mom, or even sometimes repeat moms, still can stay the same amount. We're not pushing anybody out the door, but I do find that I'm seeing some more push from the patient to like get out as soon as possible, because they're used to having the.
It's more of an urgency and an antsiness that
Yes.
everybody has in one way or the other with COVID.